Welcome to this special episode of Neuro Stories, created to accompany the TV series Trauma Room 1, which focuses on neurosurgery here at the Walton Centre. In these episodes, we go beyond the screen to bring you closer to the incredible staff and patients featured in the documentary, delivering outstanding services every day.
Hi, my name is Srikandarajah. I'm a consultant neurosurgeon and interest in complex spine.
Hi, my name is Stovell. I'm a consultant neurosurgeon and complex spine surgeon with an interest in complex spine and traumatic brain injury.
Wonderful, thank you both. You've both had a couple of cases on the show. You've been featured in a number of episodes. What's it been like having the crew in over the summer?
I think it was a good opportunity for us. We're a high volume centre. We do quite complex cases, but very typical of Northern mentality. We kind of get on with our job and do the hard stuff, and we don't showcase as much. So it's nice to have the opportunity to have a professional team here to record. So, me and Matt had a chat with each other, and we thought there's quite some interesting cases that we do, which in other places will be incredibly rare. So it's a good opportunity to bring that out to the public, to educate them about what we do.
I echo what Nish says, but also there's the human side. It was nice working with the crew, having different people to talk to and explain what we're doing and to educate the public and give them a sneak peek and a view into the work that we do, as well as patients themselves. Some of them have enjoyed and their families have enjoyed watching the episodes, I understand, as well as our families as well. It's always nice for your own family to see what you do at work when you get in your car and you drive off to work and then you come back in the evening. They don't really know what you get up to, and this is that.
Yeah, it's that classic, how was your day? And you go, oh, it was fine, but actually there's this longer story to tell. Was it interesting having a camera in theatre with you?
So the film crew were really professional, really excellent. There was a concern that, will it distract us? But they didn't at all. They asked questions at appropriate times. There is a bit more pressure having what you do filmed, and of course there's always an element of risk and pressure that is inherent to neurosurgery and spinal surgery and brain surgery, but having everything recorded does add another dynamic to the whole process. In a lot of the cases, although they were complex, we had each other's support, which is takes some of the pressure off.
I usually like listening to music while I'm doing my cases, and I wasn't allowed to. So that upset me a little bit. But then, occasionally they'll stop you and ask you for questions, which felt quite unnatural during an operation, because we don't usually, we choose when to explain it to people, but they'll stop you and ask you, tell me what you're doing right now. And then it was a bit unnatural. But then when we're working together, both of us, one person can concentrate on the case and the other person can sit there explaining. So it was doable.
And what did you think when you were first asked to get involved?
What I would say the benefit of what we've experienced is we've been out to other countries to do fellowship. So Matt's gone out to Australia and I've gone out to Toronto in Canada. And I think what we've seen over there is people are very much open, very much about showcasing what they do because they're doing complex operations. And I think because we've had that exposed for a year, the environment you're brought up in the NHS in the UK is very conservative. You're very quiet and you just get along with things. But I think because we've had that exposure, we felt that this was the time to show everything that we do.
Yeah, happy. I think having the experience in other healthcare settings where it's a bit more marketing, a bit more promotion, not in an inappropriate way, but it's not classic UK, British mentality necessarily.
Keep calm, carry on.
Yeah, or an NHS approach. The other thing is there's a little bit more concern as it's not just patients watching, but also colleagues watching. You don't normally get colleagues from other units watching what you do. They probably won't be, but if they were, then there's the assessment by peers as well. Another dimension of pressure.
Have you watched yourselves on the programme? Did you watch the episodes that you've been in so far?
Yeah, actually, we were away in a conference last week when it aired. And when we came back, I saw it with my family. It was quite nice, actually, because my kids were impressed that I actually do something for a living. I think my wife done a lot for us, and I think it's good for them to see as well. And, they enjoyed it as well. So it was really nice.
Yeah, absolutely. First of all, I was happy with how the patients have done, but that was already evident before having seen them myself post-operatively, but also that it was a fair representation of their history before the surgery, the operation, and I thought the operation was represented quite well, and the anatomy, because it was what I considered an interesting operation, and then their post-op recovery. And I thought it was all represented well, and I felt that we came across okay as well, because you're always worried how you will appear on TV. I very much enjoyed watching it.
Do you think it's been good to showcase spinal surgery in particular?
In terms of neurosurgery, most of it is spine surgery in terms of the emergency cases and the elective cases. But in terms of the morbidity and the detriment to society, there's a massive impact that spinal conditions have. And we are, if not one of the most busiest and largest centres in the UK for spine surgery, and we're a single site centre as well. It's very unique. So in terms of the throughput, it's immense what we have here. So we get a lot of rare and complex cases. And, you know, we've got a great unit of spine surgeons. We all get along really well together. We've come in as a unit and we work together. And I think that's quite special. That's not there in many other places. And we've created something special here. So I think, you know, yes, I think spine surgery needs to have a bit of limelight behind it now.
What's it like to have that multidisciplinary team featured in such a way on TV as well?
Yeah, it's the team and the equipment that are available at the Walton Centre. We are very fortunate. We have fantastic equipment, as well as fantastic surgeons. We have fantastic equipment and fantastic specialists like Dr. Michael Pridgeon, who's an excellent neurophysiologist and a leader nationally. And we work closely with him to help inform the progress of our higher risk surgeries around the spinal cord, and that does help and benefit patients, not just in surgery but also pre and post-op. Therapists, physios, OTs, speech and language, and the nursing, all the therapists help patients improve their function afterwards, and we have fantastic therapists here as well. Having such a good team, and of course I mustn't forget the anaesthetic department as well, who are excellent, and you know, we work so closely with, and we have such good relationships with working in such a small hospital. But also, it's not just individual experts. Because we work together so well in a team, we become an expert team. And I think that really helps provide the best outcome for our patients.
Your relationship as friends, as colleagues, comes across quite well. You work well together when you're in surgery. You've known each other quite a while, haven't you?
Yeah, so we actually, we went to medical school together, but we didn't know each other in med school.
Big medical school, over 300 each year.
Yeah.
Okay.
I was friends with your cousin though.
Yeah, you were. So he knew me through family, but not. We're both from London as well. We got our training numbers in Merseyside, so we Googled Merseyside and it said Liverpool, so we came up here. And then we've spent, it's an 8-year training programme, so it's quite gruelling. And then on top of that, we both have done a 3-year PhD in different locations. But we've been together through that whole process. And when you share over a decade with someone training, you tend to share very extreme experiences in terms of, we're dealing with life and death here, you know, in terms of neurosurgery and spine surgery and high risk surgery. You go through a lot together. We've bonded and we've gone through a lot. And also, Matt is a very good pair of hands. Technically, he's very good as a surgeon. You know, when you can trust someone a lot, and also you can have a laugh with them in theatre, it changes your job completely to be working in that environment, because you can share the decision making, you can share the risk with someone else and know that you can trust their opinion and their technique. And I think that's really special, you know, and it's not just Matt and me, there's other colleagues we work with as well who we have that relationship with. I think that's helped make us who we are today.
I'm feeling all warm inside. Just as Nish said, I mean, we've known each other a long time. We've grown to become friends, and our families are friends. And we spend time inside work and outside of work together. That saying, enjoy your job, you'll never work a day in your life. A lot of it is who you work with, and you get to come to work and see your friends and spend time with your friends. It's great. Doing this and going through this, the good times and the bad, with a colleague who's also a close friend is fantastic. Pragmatically in surgery, trusting each other, I think, is really important. Trusting each other's ability, trusting each other's experience, and trusting each other's intention and the ability to communicate, that we can speak to each other and we know that we're not criticizing each other in a rude or negative way. If we say, oh, hold on, stop. We have the patient care and caring for each other at the centre of what we're doing.
What is it like being a surgeon at the Walton Centre?
I think we've got something really special. at the Walton Centre. I said this before and I don't mean it in a rude way, but we do have that very northern mentality of just get on with it. And I've seen that throughout my training. The level of cases we're doing is immense here. We get a lot of rare pathology, so we get very unique experience. And there's a lot of people who have come from different units and different institutions. All they've ever said is, this is amazing what you guys have here in terms of how you are with each other, in terms of the technology and equipment you have. It's second to none. Essentially, what I would say we're running here is something on the equivalence of a Mayo Clinic over in the US. It is high level here. TV program allows us to showcase that. As surgeons working here, we're getting the best of everything. I think it's unique. I think we've got something really special here.
I'd echo that. I've worked here, I've worked in other excellent units. It's what you compare it to. I always thought that we're very fortunate to work at the Walton Centre with the infrastructure, the equipment and the people, and the fact that the relationships between staff are generally very positive. Particularly, I can speak for the surgical side, then it creates a good environment for the registrars and then a good environment for also the SHOs and the nursing. It's not a panacea for all relationships, but I think it does percolate it throughout the care of the patients. Also, objectively, we get people who come from other units for fellowships or as consultants, and they will often say, objectively, compared to other places that they've worked in, we don't realize how good we have it. And not in a complacent way, but just the vibe and the relationship between staff and also the way the hospital is run. But it's really good and well above the standard and the average that you get elsewhere in the country, which is also represented in the league table for care in trusts recently. We did very well. I know we're a specialist trust, but objectively speaking, we are very fortunate to work here. It is an excellent hospital.
And the opportunity to go further here is immense. So in terms of research and procedures that we do, I think, we've got the opportunity to expand it further with the team we have.
Thanks for listening to this special episode of Neuro Stories. All episodes of Trauma Room 1 are available to watch on My5. Just search Trauma Room 1 to catch up on the latest season now. For more episodes of the podcast, find us on Spotify, Apple Podcasts and YouTube, and stay up to date with the latest news and events from the hospital on our social media channels, at the Walton Centre on Facebook and Instagram, and at Walton Centre on X. If you've got any feedback, email the communications team at wcft.communications@nhs.net. This podcast was recorded, edited and hosted by Sam Fleet from the Walton Centre's communications team.